Hi guys, Mina here. The reason I'm actually making this video, this is my first video by the way, and the reason I'm actually doing this video is to share with you guys all my experiences on doing braces. I've actually reviewed a lot of videos and I found a lot of videos on YouTube that was really helpful, and I think that I would also want to document whatever that's happening to me and whatever procedure that I will undergo. And also the other reason was because there wasn't much of an adult orthodontic braces treatment done on YouTube. I mean, there wasn't much video on that, so I think it would really help. I'm 26 years old, and the reason I'm actually getting braces after such a long time is because it just never really came up. I always wanted braces for almost 10 years now, but I've always asked my mom to do it, and obviously she was like just putting it off, and there were also school and all those other things. I know it's not an excuse to not have them, but yeah, so now I'm working and also studying masters. I'm working part-time as a teacher, so now I have my own cash, and yeah, I can go about doing it. So the first thing that is happening, I'm not so sure on what do I have to say. Okay, the first thing that's happening is I've gone to a few orthodontic centers, a few orthodontic clinics, and had a few options that was given to me. The first option was to actually remove my wisdom tooth, and because my upper wisdom tooth are really impacted, so they said that it was semi-impacted, so I have to undergo a very minor surgery just to remove it, and there will be a few stitches, and that was it. They said that after I've done that, I can get my braces and also an x-ray. So what they told me was just to get an x-ray and also to get my wisdom tooth, my two upper wisdom tooth removed, and yeah, that's it. So this was an opinion from a dentist in a private clinic. And after I've got that, I actually went back to my hospital, the place where I'm doing my research. Since I'm a student there, I get a specific discount or even some free treatments there. So I was thinking, why not just get my extraction there? Because doing it in the clinic would be, I don't know, 600 to 800 bucks per tooth. That's really expensive, guys. So I just had to tell the dentist that I'll go back to my hospital and I'll do that, and I'll come back with the x-ray, and she agreed. So when I went back to my clinic, they actually refused to give me any treatment because they said the clinic that I went to previously was not a certified orthodontist, and I did not get any letters to say that I have to remove my wisdom tooth, and so the dentist there refused to give me any treatment. So yeah, I waited for 2 to 3 weeks for that. And guys, you really have to know that I'm really rushing for time here because I'm already 26 and I really don't want to push it any further, and I'm planning to get married in another 2 years. I'm planning to, so I don't want to take any chances. I don't want to wait for so long. So I asked this doctor, I asked her on what do I do. I mean, since she's saying that she's not gonna do it for me. So she explained to me that there is this dentist that she knows who is a certified orthodontist under the Malaysian Association of Malaysian Orthodontics Center or whatever. So she told me that this doctor visits the government hospital once a week to treat cleft palate patients, and she's quite successful, and it's actually located at Ampang Point. So she told me to consider going for the whole thing under her, and she also told me that she could actually ask the dentist there to give me a letter to say that I am allowed to do my surgery to remove my wisdom tooth in the government hospital, which will be free, and also the x-ray will be free. If not, then the x-ray will be around 60 to 80 bucks, and the surgery will cost another 800 per tooth. So I was really into that. I told her that yes, I'll do it, and so yeah, so she gave me a letter I don't think I have the letter. So she gave me a letter and she asked me, she was so nice, she even called her friend. Her name is Dr. Asia in Ampang Point, and she called a friend and she said, hey, I have a student who's working in UKM hospital and she's really looking forward to doing her braces, and also she will need some surgery on her wisdom tooth, so it will be really good that if you can help her. So this doctor said okay apparently, and she gave me the letter. And today I went for an appointment at 2:30 in the 2:30 p.m. So once I've gone there, she checked out my teeth. So let me just give you a quick look on my teeth. So yeah, you can see it. This is the tooth that's really giving me a lot of problem right now. It's really coming out here, and this one is really bothering me, guys. I know it's my family members and my boyfriend and my friends are saying that it's not so obvious, but I just feel like it's so obvious whenever I'm doing anything, and even when I smile in front of a camera, I'm really self-conscious about it, and I've always wanted to change it. I've always wanted to change how it looks like. I know it doesn't, okay, look, if I smile, I know it doesn't really show, but if you see it from the sideways, you can actually see me. Can you see it? So initially I just thought that, I was thinking that it was just my, oh my god, look horrid right now. Initially I thought that it was just my upper tooth, upper jaw, but after the treatments, the doctor said I would need I will need braces on my lower teeth as well. So here's my lower tooth. So it's not so straight. It's on here, so here. So when I went to the dentist today, she actually told me that I have to extract 4 of my premolar tooth, and I was horrified. I was really shocked, and I did not want to do that, and I just kept asking her, like, is there no other way? And she told me, yes, of course, if you just want to remove your wisdom tooth and do the braces, yes, you can, but it will impact me, as in once my teeth get straight after the braces, it will just come out a little bit. She said it would not be too much, but it will come out to the point where this teeth is out right now. So it will be around like in front, to the front. And I did not want that. I mean, the reason I'm doing braces is to have like a really good structure, really good arch on my teeth, and a really good smile. So I said no, and I told her I'll just think about it. It was really scary to even think of pulling out 4 precious healthy teeth. And she said she's gonna pull out my, so this is my incisors. So she said that this is the incisors. This is the first premolar. So I am assuming that she's gonna be pulling out my second premolar, which is around here, and also the bottom second premolar. So I'm really worried about it. And so I came back home and I started googling a lot of things to see whether if this is common, and of course I've seen it that it is. And now before this, after I went out of the dentist, I was horrified, and I told my boyfriend, I called him up and I said, does this really bother you? Because I feel like I'm not going to pull out my teeth, I'm not going to do it, so is it okay? And he said, whatever that you want is fine with me. So now that I've watched all these videos, I think that I might reconsider doing it. And because I saw that what I saw on the video was that once they have pulled out these teeth, and once they have put the braces on, as time passes by, they actually close the gap because when you have teeth crowding like mine, crowning teeth, it needs a gap in order for it to become straight back again. So I guess that's the reason for them to remove those premolars, and I hope I'm making the right decision. I'm going to make more and more reviews on it, and I'll try to put the link below on the reviews, and maybe you can check them out if you're also thinking on taking out your premolars and also doing braces like me. I'm 26 years old. I know it's not a big deal. I know a lot of people have done it before, but it's just scary when you've not really done it. So yeah, so I'll keep you guys updated. What I'm going to be doing is on Monday I'm going to be getting that letter to get the surgery, and I'll keep you guys updated. So sorry for the horrible lighting, and because my laptop is not working. It's not working. The camera's not working. I don't know why. It's been a long time since I've used it. Maybe that's the reason. And also, yeah, so, and sorry for the horrible mess, because I'm not ready to go and put on makeup or whatever. No, this is what you get. So